फोन जाओ वाईफाई बंद हो गया था कभी क्यों पता नहीं चल गया चेक कर लो आप एक बार
Welcome back everyone. Now let's move ahead with second wonderful session. We feel deeply honored to welcome our respected chairperson Dr. Mohan Sir, Principal Sanskriti Ayurvedic College Madura and co-chairperson our very own Dr. Gauri Shankar Sir. So let's welcome our respected chairperson and co-chairperson on the stage.
Knowledge finds its true meaning when it transforms into experience, when the principle of wisdom touch real life and bring healing. As we continue our journey through this enlightening Ayurveda seminar, we now are at session. This bring the essence of classical Ayurveda into the heart of real clinical practice.
Yes, indeed. This upcoming session is a wonderful opportunity to bridge the timeless principles of our ancient texts with the realities of modern healthcare. A journey from Shastra to Chikitsa, from theory to healing. This topic for the session is clinical experiences with classical Ayurveda.
To guide us through this insightful session, we are deeply honored to have among us a very resourceful and respected personality, Dr. Gopakumar Sir, a name synonymous with dedication, expertise and excellence in Ayurvedic clinical practice. He is sharing as member academic council of Kerala University of Health Science.
I would respectfully request Dr. Pravini Valsalan ma'am to introduce us with Dr. Gopakumar Sir.
I welcome Professor Dr. Gopakumar Sir onto the stage. Respected dignitaries and delegates, it gives me immense pleasure to welcome Professor Dr. Gopakumar S., a distinguished scholar, teacher and physician in the field of Ayurveda. Dr. Gopakumar is the Registrar, Kerala University of Health Sciences, Chairman, Board of Studies, Pre-Clinical PG of Kerala University of Health Sciences, and Academic Council member of Kerala University of Health Sciences. A first rank holder and gold medalist in BAMS, he holds 2 MD degrees in Kaya Chikitsa and in Roga Nidana, and PhD from Kerala University. With over 2 decades of academic and clinical experience, Dr. Gopakumar sir is also guiding many PG and PhD scholars of Kerala University of Health Sciences. He has represented India in the international conferences across the UK, Russia, Thailand and Australia, and has been honored with numerous state and national awards, including Bishop Ratna Award, Dhanvantri Puraskaram, Best Teacher Award, Dronacharya Award, Agnivesh Award, and numerous more. A prolific author and inspiring speaker, Professor Dr. Gopakumar continues to be a guiding force in Ayurvedic education and research. Please join me warmly in welcoming Professor Dr. Gopakumar sir for the session. A grand round of applause, please.
Hello. Hello. Good morning. And this is a Manda Guna good morning. Maybe due to the Shida Guna outside. Yesya Stambhani Shakti Sa Shida. Am I right, sir? Which can make Stambhana is Shida. Good morning. Good morning. Now this Manda converted into Tikshna. When we talk about Ayurveda, our Agni should be in Tishnavastha. Our Agni should not be never in Manda stage. And in next 1 hour, my dear friends, I will talk only what I studied and what I applied with all evidence. Whatever we studied in Ayurveda principle, I will be telling how I applied in my practice with all experience with the evidence. So the first line, clinical experiences with the classical Ayurveda. Dear students, at any time you can ask me, Mr. Gopakumar, stop. Because I am not a radio. You cannot ask any question to the radio. Radio only will be played. So I am not a radio. At any time you can tell me to stop it. And can you don't talk here? Okay, please. Whatever you have to talk, finish it. When I talk, keep silence. Okay. This is okay, no problem. These things are formal, no problem. Thank you. Okay, so the topic is classical experiences with the clinical Ayurveda. See, the junior doctors, please pay attention. Please pay attention. Only this 1 hour is only for you that you will identify after the 1 hour. Okay. See, all of you, please imagine that you are sitting in an OPD. Imagine. All of you, please imagine that you are sitting in an OPD and you are a doctor. Okay. You are getting a patient and one patient is sitting in front of you. Now I am telling you, explore the signs and symptoms. Patient will tell A, B, C, D, I am having that problem, this problem. You listen patiently. Never interrupt the patient in between. Let them talk. Because patient is your guest. Am I right? Patient is your guest, so listen carefully. Locate the site of lesion. Very important. When I use the word site of lesion, I don't mean that it is elbow joint. I don't mean that it is the left ventricle. I don't mean that it is the brain or cerebrum. I mean the adhisthana of the vyadhi as per Ayurveda. Are you getting me? Are you getting me? What is the difference between site of lesion and adhisthana of a vyadhi? Any Ayurvedic thoughts you can freely tell. It is not a viva. Say for example, I will tell you, a patient is having a stone in the ureter. Imagine. Yes or no? See, sir, okay, so what I am telling, a patient is having a stone in the ureter. What is the site of lesion? Ureter, no doubt, it is ureter. But my dear friends, according to Ayurveda, Ashmani is the equivalent of stone, which will be always seen with the Pakkovasya of the Adhisthana. Are you getting me the difference? According to Ayurveda, ureteric stone is considered as a vyadhi located in where? Pakkovasya. So I will tell you, when I am treating that patient with the calcium oxalate crystal, considering as Ashmari, definitely I will give a medicine like Brihatyadi Kashayam, Veeradaradi Kashayam. These two are the very important medicines prescribed for the Ashmari, Brihatyadi Kashayam and Veeradaradi Kashayam. My dear, please, what is your problem? You only listen carefully. You are a student, no? Are you a student? Yes or no? Listen here, please. Okay. So when there is a class, just stand up. You only, my dear. You. Please. Which year you are studying? Second person. Have you studied Ashmari? Have you heard the word Ashmari? What is Ashmari? How many stones are there according to modern? Listen. Okay, you are going to learn. Sit down. Okay. So if there is a calcium oxalate crystal in the ureter, as per modern medicine, it is a case of ureteric stone. But according to Ayurveda, it is a case of Ashmari, and calcium oxalate crystals will be having irregular shape, thorny appearance, Kandagai river. So we will consider that depending upon the clinical feature, calcium oxalate crystal is somewhat similar to Vadika Ashmari. Are you getting me? Then naturally you will think about a medicine called Veeradaradi Kashayam, which is indicated for Vadika Ashmari, that you will give. But the problem is, we are treating this disease as per modern Chinda. I am telling you to think Ayurvedically, so Ashmari will manifest in Pakvasya Gada Vada. That is the point. Are you getting me? Ashmari will manifest in Pakvasya Gada Vada. So I am going to tell you how we will correct Pakvasya Kruddha Shulana Andra Gujanam Malaroda Ashma Bhartha Aksha Trika Prishta Kadigirha. So, what is your responsibility? Along with prescribing a medicine against Ashmari like Veeradaradi, give a medicine which will create normalcy of Vada in Pakvasya. The example may be Gandharvakastadi Kashayam. Are you getting me? So the conclusion point is, you are treating the disease by a medicine and you are treating the site of lesion by another medicine. So according to Ayurveda, site doesn't mean that it is an organ. It may be Adhisthana like Amasya, Pakvasya. One more example I will tell you. Somebody is coming with bronchial asthma. Somebody is coming with Tamaka Shosa. We very well know Tamaka Shosa is caused by a bronchial problem, a bronchial congestion, and patient is feeling difficult to take breathe in and breathe out. But according to Ayurveda, Urastaha Kurude Shosam Amashaya Samutpavam. So according to Ayurveda, Shosa Loka is created from Amashaya. Until and unless you are treating the Amashaya with a medicine, you are not going to treat the bronchial condition. That is Ayurveda. Clear? So now I will tell you, according to modern trachea, bronchus is getting congested. You give a medicine called the Thiobayam Kashayam, Dashamula Kadatrayam Kashayam. You give a medicine like the Ela Kanadi Kashayam. All these three medicines will remove the congestion and patient will feel healthy. But there is no medicine for the Amashaya which is producing the Kapha, the Sama Kapha. So please prescribe Vaishwanara Churnam 15 gram for 3 to 5 days for Amashaya Shuddhi. Are you getting me? So what is the difference? You are treating bronchial congestion according to modern science. You are treating Amashaya by Vaishwanara Churnam according to Ayurveda. This is what I mean. The Ayurvedic thought process tested by the modern evidence. Definitely you are going to get success. Is it clear or not? 100% clear or not? Okay, so because this speech is for you only. And then identify the dosha dosha profile. How to identify the dosha? A patient is coming and telling that there is edema in the ankle joints. You are still sitting in the room and you are a doctor. Don't forget, I told you to imagine as a doctor only. A patient is in front of you telling that there is swelling in the ankle joint which is increasing in the evening, which is becoming less in the morning and increasing in the evening. Any shobha, any swelling which is having a fluctuation, the swelling is changing its nature day by day or time by time, will be always Vadika. Why? Because Vada is Vishama Guna, Vada is Chala Guna, and Vada will be having Yoga Vapi property. So the fluctuation of the nature of the swelling will be Vada. I very well know you know the properties of Vada, Tatra Ruksha, Legu, Shida, Kala, Sushma, Stalo, Manila. So wonderful, they know the Vada property. Let us clap for ourselves. Nobody will clap for ourselves. Very be behaving sometimes to the right, sometimes to the left. So, a fluctuation in the nature of the swelling indicates Vata. Now, you imagine another type of swelling where you are getting tenderness. You cannot touch the pain. You cannot touch the area with the swelling. If you touch the area, the patient will withdraw the limb. That is called the pain on touch, sparshakshamatvam. And there is local temperature and there is local readiness. Daka, Raga, Paga, Shobha. No doubt the dosha will be absolutely correct because Vittam, Sasnena, Krishnoshnam. So I told you, and another case, the same patient is coming with the swelling and it is very hard, cold swelling. The hard, cold swelling and it is always Sita Guna, Manda Guna and Snigdha Guna. No doubt it will be Kapaja Shobha. So every case, my dear friends, try to identify the Vata Pitta Kapha by the signs and symptoms. Are you getting me? I will tell another case. A patient is coming with the rising temperature. Joya, we call it as fever, pyrexia, and very fastly, suddenly, within no time, the temperature is shooting to 103 degree Fahrenheit. It is Tikshna, Ushna, Ashugari, the Joya will be, it is shooting very fast from 99.8 to 103 by minimum time. It is Ashugari, Tikshna, Ushna, that is Pitta. No doubt it is Pitta. And you are getting another case of Joya where the temperature is always 98.4 and 100. It is slow but long standing. It is slow but long standing. Mandam Chidagariga, which dosha? Kapha. And you are getting another temperature, a pyrexia case where the temperature is up and down. Vishabha Bhava. It is Vata. So now you know how to identify Vata Pitta Kapha in any clinical feature. I will tell another case. You are getting a patient with Adisaya. You are getting a patient with Adisaya and you know blood stained Adisaya is there. Adisaya with the recta, Adisaya with the burning, Adisaya with ulcerative colitis. Definitely it will be indicating which dosha? Pitta dosha. And you are getting an Adisaya with mucoid dysentery. Only mucus, mucoid dysentery, it will be Kapha. You are getting Adisara, in between there is constipation, irregular bowel, then it will be Vata. Now everybody know how to identify Vata Pitta Kapha. This is the way to identify Vata Pitta Kapha by any methodology in signs and symptoms. Okay. Then go to the Vikalpa Samprapti. That is the cardinal statement I want to make clear. What do you mean by Vikalpa Samprapti? Vikalpa Samprapti, second year student, third year student. No, I won't wait for your answer. You know it. I am telling Doshanam Samavedanam Vikalpo Amsha Kalpana. Very good. Doshanam Samavedanam Vikalpo Amsha Kalpana. What is its use in practice? I will tell you, Amsha Kalpana means the quantitative mathematical calculation of involved doshas in a samprapti. I will make it clear. Say for example, you are getting a skin case. You are getting a dermatological case. The patient is telling that there is dryness in the skin. There is dryness in the skin. There is scaling of the skin. And in between there is itching. Occasionally there is thin mucus discharge. Imagine dry skin, scales in the skin, occasional itching, and sometimes you are getting a discharge. Dryness, scale always due to Ruksha Guna. No doubt which dosha is there? Vata. In between occasional itching, Kandu is due to Kapha, and little bit of Srava which is not so first, not so recta. So again Kapha Srava. So you got Vata Kapha skin disease. Are you getting me? So by the science and symptomatology, you made that Vata is 60%, Kapha is 40%. This mathematical calculation of the involved doshas in the combined pathogenesis is called Vikalpa Samprapti. Are you getting me? In Ayurveda, actually there is mathematics. But unfortunately, we people use mathematics only in the dose and when we mix the masti or when we do some preparation of the medicine. But everywhere it is mathematics only. I will tell you, in a cell, imagine in a cell, a biologically active cell, if there is more rukshata, what will happen to the cell, sir? What will happen to the cell?
Degeneration.
The cell will lose the water, first of all. cell will lose the water, and then what can be the future? It can develop dehydration. Am I right? It can develop dehydration, it can develop demyelination, and as rightly he told, it can develop degeneration. So my point is very simple. Depending upon the impact of individual guna in a particular cell, which dosha is vitiating, that mathematical quantification is called Vikalpa Samprapti. I will repeat it once again. Please follow me word by word. In a particular disease, in a particular cell, how much percentage of a guna created a chain by which a dosha is vitiated, that total mathematical calculation is called Vikalpa Samprapti, told by our acharyas in a simple statement: doshana samavedana vikalpo amsha kalpana. I will tell another case. You know fatty liver? You know fatty liver, what is happening in fatty liver as per model? They will go for the USG, and then they will tell that moderate or mild or severe fatty liver. What is fatty liver? The triglyceride level will be increasing, and the patient will be getting a mild coating. And hepatocytes. What is hepatocyte? That is the egur paramanu. The fundamental cell of the liver is called hepatocyte. I am very happy to call it as egur paramanu. In egur paramanu, in hepatocyte, there is kapha medo dushti. Are you getting me? Normally the liver cells will secrete bile, and biles will do pajanam, pachaka pittam. But instead of that secreting of the bile, the cells will be having kapha medo dushti by snigdha guna. Kapha is snigdha, am I right? Snigdha, sido, gururmanda, slashna, prasna, everywhere fundamental. Kapha is snigdha and medovaha srodasi is snigdha. How medovaha dushti happens by charaga? Avyayama, divasopna, medyanam chadi vakshanad, medovahi dushyati, vayunescha adhisevanad. Alcoholic steatohepatitis. Vayu is nothing other than madhya. So medo dushti by snigdha guna, kapha dushti by snigdha guna. Where? In hepatocyte. What is hepatocyte? It is pitta sthana, because liver is pitta sthana. Why liver is pitta sthana? Shodika vahanam srodasa edur moolam prihacha. Are you getting me? Are you following me? Really following me? Okay, so liver is pitta sthana because it secretes pitta. In pitta sthana, kapha medo dushti by snigdha guna. So this is the Vikalpa Samprapti for fatty liver. So next time I will tell what is fatty liver in Ayurveda. You will be in trouble. Ada the fatty liver nama adhyayam vyakhyasya idigasmahu ratrayadayo magashya. ऐसा कोई श्लोक है या नहीं? चक्रवाणी ने नहीं बताया कि ऐसा एक श्लोक है. दलना भी नहीं बताया. Ada the non-alcoholic steatohepatitis nama adhyayam vyakhyasya. No. But using your common sense, you can identify that. I know Ayurveda, I know fundamentals. I am going to tell that fatty liver is nothing other than kapha medo dushti by snigdha guna vikalpa in pitta sthana liver. Yes or no? Yes or no? Yes. See, this is the way to think. Then what is the answer? What is the answer? So if it is kapha medo dushti by snigdha guna in pitta sthana, what is the answer? Solution. What is the solution? That patient is sitting in front of you. I told you, one patient is sitting in front of you. You will prescribe a kapha medo hara medicine which will work in liver. Yes or no?
Yes, sir.
You will prescribe a kapha medo medicine which will work in liver. You will take the pen and confidently write Varanadi Kashayam. Why Varanadi Kashayam? Varanadi Kaham Medo Mandakinitum Niyachadi Adhyavadam Shirashulam Gulmancha Andasa Vidravi. Varanadi will bring down kapha. But Varanadi cannot go to liver, because Varanadi is not a liver specific drug. What you will do? You will add Padoladi Kashayam, Padola Kadalohini Kashayam. What is Padoladi Kashayam? Padola Kadalohini Chandanam Madhusrava Guluji Padanidam Nikanti Kavavitta Vishamari Vishambami Marojagam Kamala. So what is the yoga? Padoladi is the rocket in which you are keeping the Varanadi as the satellite. Then what will happen? Padoladi will take Varanadi to the liver, and both the Padoladi Pittarasa drugs and Varanadi Kavamelohara drugs will bring down the snigdha guna in hepatocyte. That is this prescription. Are you getting me?
Yes, sir.
How this prescription is created? Only by your thought process. So this is the methodology to think in Ayurveda and apply in Ayurveda. That is what I am telling. Vikalpa Samprapti. I will make one more example. You are getting hypothyroidism. Hypothyroidism means what is happening? Less T3, less T4. Am I right? Less T3, less T4 and Manda Guna by which less production of the hormone. Srodoroda, Avarana, Manda Guna. What is hyperthyroidism? More T3, more T4, Krishna Guna, hyperactivity of the thyroid. In hypothyroidism, Apravarti, Manda Gunam, Kapham. In hyperthyroidism, Adipravarti, Krishna Gunam and Pittam. So you will prescribe Asanati Ganam in hypothyroidism, Kapharam. And you will prescribe Shadavariyadi Kashayam in hyperthyroidism because Shida Vidyam Ushna Shamana. This is the way to think in Ayurveda. Are you getting me? Yes, sir. Clearly getting me? Because at the end you have to treat. There will be 5 cases in front of you. So that is what is called Vikalpa Samprapti. Then there is the pathogenesis. Pathogenesis means Samprapti. What is Samprapti? Samprapti is the screenplay of a disease. Samprapti is the screenplay of disease. Yatha Dushtena Doshena. Somebody is telling Yatha Visarpada Nurvarti Ramayasya Sampraptu Jadi Jagadi. In movie there will be a hero, there will be a heroine, there will be a villain. Am I right? Like that in Samprapti, Dosha is the hero, Dadu may be the heroine and Ama may be the villain. In between comedy will be there, tragedy will be there, in between the disease will up and down and that is called Samprapti is the screenplay of a disease and Samprapti Vigatana is Chikitsa. Okay, then finally decide the treatment strategy by considering the dosha, dosya, vikalpa, Samprapti. You may know I should write this medicine, this advice, this ahara, this vigara, then naturally you are completing the treatment. And you do the experiment once again. If there is anything to be corrected, correct it, that is by Upashaya and go to the final treatment. This is the way to address a case clinically, classically, systematically, scientifically. Yes or no? No more discussion in the next slide, only cases. This is the fundamental. I was trying to make a samskara by which how to think using Ayurveda by respecting the modern medical science and then you have to go to the realistic experiments. Okay, so that is what I am telling. My dear junior students, you are the people who to think in Ayurveda properly and then you will get the disease. So, by humble left ventricular request, Hridayam Chedana Sthana Muktam. So, when we talk about Ayurveda, Jnana, Vijnana, Prana, Pramana, it is always coming from the left ventricle. So, think the patient by using these 7 steps and you will be getting the result. Now, I will be telling the real cases, how I treated by following the same methodology. Are you ready? Yes. Okay, so next slide. It's a case of a diabetic ulcer. You can see the diabetic ulcer, a very, very big ulcer. I started taking the photo using my mobile when the ulcer was this size. You can see the entire pink area was filled with the ulcer only. The patient was having coronary artery disease, underwent angioplasty, but again the problem due to diabetes ischemia. What is ischemia? Reduction in the blood supply to a target tissue is called ischemia, and the patient developed a non-healing ulcer and the big toe was suggested for amputation. The big toe was suggested for amputation. But the patient was with me and the surgeon who was going to do the amputation was a very close friend of mine. So they told that let us try some Ayurveda. If there is any positive outcome, we will continue. Otherwise, we have to go for the amputation. This is the slide number 1. From each stage only I got the photos in my own mobile. And you can see, again you can see the entire ulcer is there. There is a deep sinus. What you see is the Nadi Vranam. Can you see a dip in the bottom area? That is called Nadi Vranam. What is Nadi Vranam? Abhedal Bhaktashovasya Rameja Bhakta Sevinaha Anim Pradishya Mamsadi Duram Puyo Abhidavadi Gedisa Duragamanal Nadi Vasamsudha. How beautifully Bhagavad told. See, actually when we read the sloga, they will guide you in your mind. So when there is a small opening externally, the opening will be spreading through the internal mamsam and duram, which will go dura, another area, then there will be defective healing. So you can see the case with non-healing ulcer C, and then this became like this after some days, and still that sinus is there, and now it became like a Sri Lanka like that. It was in the Europe in the earlier map, now it is like a Sri Lanka, like the shape of the ulcer is a Sri Lanka, and you can see the top of the big toe, you can see the pinkish new skin is getting covered. You can see the development of the very thin, delicate, pinkish skin, which is not so strong, but it is getting covering like gradually one by one. And you can see now the big toe, which was suggested for amputation, is totally covered by the fresh skin, and still there is the sinus is there. And now the sinus is totally gone. Now the upper portion of the toe is somewhat preserved, and you can see the wound looks to be fresh. And you can see the size is getting again smaller and smaller. And now you see the healing mark from where it started healing, and finally we could save the big toe. And this is the final picture. Thank God, thank Ayurveda, thanks to Tiktaka Kashayam, Gukuli Panchabala Churlam, Tripaladi Krudam, Chandra Prabhavadi. These were the 4 medicines. We could save the big toe, and the modern subject was with me throughout the treatment. It took more than 6 to 8 months to totally get it, and the entire wound was cleared. Now I will tell the theory. Prameha is a disease where there will be cledam. What is cledam? What is cledam in a single word? Don't tell sloga to the patient, because patient never studied with cleda. Cleda is any jalarupa malabhava which can hinder the healing. In wound, cleda means the high level of hyperglycemia. The glucose in the blood is cleda. Mutrasya cleda vahanam, that excessive cleda will be removed by the mutra. That is what is called polyuria. Mutrasya cleda vahanam, the increased creatinine in the blood is again cledam. That cledam is removed by the mutra. Mutrasya cleda vahanam. So cleda will definitely prevent the normal healing. So my target was to bring down the cleda in the recta. That is to bring down the sugar, to bring down the cleda in the prana. Prana cledam, recta cledam, both are to be reduced. That is why I selected Tiktaka Kashayam. You know what is Tiktaka Kashayam? Where it is mentioned Tiktaka Kashayam? Tiktaka Kashayam, where it is mentioned, there is a textbook called Ashtanga Hridayam, there is a sthanam called Chikitsa Sthanam, there is a chapter called Kushta Chikitsa, there is a drug called Tiktaka Kashayam, and it is mentioned Padola Nimbakadagadani Pada Vidala Papadam Trayamanam Jabalaksham Pade Dava. And finally, please come with me. Bhagavata started telling the indications of the yoga. Bhagavata started telling the indications of the yoga. Sir, he is going like a poet. Bhagavata is a poet. Pitta Kushta Pari Sarpa Pitaka Dahad Brahman. Kandu Pandovamayan Gendan Dushtamali Brahmaji. Padantera Mavasmara Udajam Pradajam Geram. Asho Asraduktamanyam Sasugitran Pitta Jan Gadan. Are you getting it? How poetically he told all the skin pathology, burn pathology, lifestyle diseases can be cured by Tiktarasam. Tiktarasam is Shoshanam in nature. In a diabetic case, in a Medodushti, in a prana, where there is cledam, you should do something by cleda Shoshanam, you need Tiktarasam. And when there is Tiktarasam, Tiktarasam will bring down the cledam, Tiktarasam will bring down the Samakapam, Tiktarasam will bring down the Medodushti, then naturally the wound will become clean and will be ready for the Ropana. This is the fundamental principle. So I will tell you, Ama in the Costa, follow me carefully. Ama in the Costa is pathologically similar to cleda in the recta, is pathologically similar to Abhishyanda in the netra, is pathologically similar to Shobha in the Sandhi, remaining I don't know. I understood the 4 things by 25 years. Ama in Costa behaves equal to cleda in recta, is equal to Abhishyanda in netra. Abhishyanda in netra is equal to Shobha in the Sandhi. All the 4 needs Apatarpana Chikitsa. Am I right? Yes or no? Again, Manda Guna yes or Krishna Guna yes or no? So this is the way to think in Ayurveda and apply with the logical prescription. I am telling you, my dear, Ayurveda is never a magical science. Ayurveda is a logical science. Are you getting me? Ayurveda is a logical science only. So this is the case which I treated with the diabetic ulcer, coronary artery disease. The surgeon suggested for the amputation, but our medicine. I will tell you the key medicine. Guggulu Panchabala Churna. Have you heard about Guggulu Panchabala Churna? Guggulu Panchabala Churna. Have you heard about? Now you are going to hear. If you not hear, it is mentioned in Bhadangara Chikilsa, not even the Chikilsa. Guggulu Panchabalam Peligam Sama Katika Katapala Taxia took to the Kasudam Mudulidam Kusta Bhadangara Gulmagadik. Is it clear? You want replay? You want replay? Guggulu Pancha slow push. Guggulu Panchabalam Peligam Sama Katika Katapala Taxia took to the Kasudam Mudulidam. Kushta, Pagandara, Gulma, Gediknam. Gedi means Nadi Varna, that is what you saw in the picture. See, this is the Nadi Varna which you saw in the case. You can see the Nadi Varna. So, when I see the case, naturally, Guggulu Panchavala Churna will come in front of me. Sir, please write me. Please write me. When I am sitting in my OPD at Human College, Kannur or Trivandrum, after 10 minutes with interaction, minimum 6 drugs will be around us. Baba Kumar, मुझे लीजिए, मैं तो अच्छा ड्रग हूँ, मेरे लिए आप कृपा कीजिए. And then 6 drug I have to reduce by 3. So this is the way how to reduce the medicine from the low quality to final. That is used by your clinical consciousness. That is what I am telling. So Tittaka Kashayam, I am telling the medicine. Tittaka Kashayam and the Guggulu Panchavala Triphaladi Rasayam, and in between I prescribe the Mandura Vadakam also, because the patient experienced the signs of Mandu. We can see the Varna sometimes feels like the pain. So Mandura Vadaka, you know Mandura Vadaka is mentioned in Pandu. Do you know Pandu? In Pandu there is Rasapradosha Vyadi, there is enough problems with the Rektasara Hani. Rektasara Hani will definitely impact in what? Wound healing. If there is Rektasara Hani, it will delay the wound healing. So I added something like the Mandura Vadaga which promoted wound healing. So this is a success story. You can see how from the very first picture, how it proceeded, and you can see smaller, and you can see the entire healing like this. Okay, now I am telling you, you cannot stay away from modern pathology. You can never stay away from modern pathology because you should know what are the things happening internally. So you always need micropathology to get the nature of progression for better understanding of disease process. You need a modern medicine. I had done the Doppler scanning by which I identified that there is reduced blood supply to the wound part. That is needed. And in between you can use Jaluga. In the same Varna you can apply Jaluga because Jaluga will remove the ectogen cleda which will be having more effect. So my humble request to the junior generation, the so-called 2025 generation, cell injury versus dosha drushti should be your thinking context. Whatever we call it as dosha drushti, ittal, vada vitiated, pitta vitiated, kapha vitiated, think in a cell. Think in a cell. If snigdha guna is there in hepatocyte, fatty liver. If ruksha guna is more in skin, dehydration scaling. Ruksha guna is more in eye, it will be sorophthalmia. Ruksha guna in the colon, it will be constipation. Ruksha guna in the joint, less synovial fluid, osteoarthritis. Ruksha guna in the central disc, degeneration, degenerative disc disease. Ruksha guna in the brain degeneration, Alzheimer's disease, motor neuron disease, Parkinsonism. Are you getting me? So that is the impact of simple Ruksha guna in a cell. Then think about the Rusha plus Ushna in a cell. Are you getting me? Are you getting me? So this is the way. Next time मैं हाथ को जोड़कर आप लोगों से बोलता हूँ कि जो सेल में क्या होता है, किस गुण से, किस दोष से कैसे होता है, ऐसा चर्चा करने का ही मौका है संप्राप्ति. What happens in a cell, how it happens with which guna, that is the simple understanding of samprapti. I will tell one simple example. You take one draksha, grapes, draksha, a very glamour, beautiful draksha. You very well know how it will be looking like. You keep the draksha in the road. You keep the draksha in the roadside. By the evening, what will happen? Think freely. There is no Ayurveda here. There is no sloga. Think freely. What will happen to in the evening to the draksha? Everybody tell. It will become sweet. It will become sweet. Why? Why? It is not in the fridge. It is in the roadside, exposed to sunlight and the dryness of the air. It is shrinking. So what you learned? The Ushna Guna of the sun, the Rucha Guna of the wind, both worked together by which the water content, kapha content in the draksha gone out. It became shrinking shosha and the glamour wet draksha became shushka draksha. Yes or no? The very glamour draksha became the shushka draksha. Then you take the shushka draksha and put in a frying pan with ghee. What will happen? You are preparing ghee, no? What will happen? It will again become the old filled draksha. The dehydrated draksha became the rehydrated draksha. Now I am telling you, you imagine the same thing in a cell. You imagine the same thing in a cell. A cell in the skin, a cell in the brain, a cell in the blood, a cell in the bone, a cell in the liver, wherever is subjected to continuous Rucha plus Ushna Guna by Vada plus Pitta. What will be the fate of the cell? That cell will become shrink. That is the favorite thing. That cell which has having water will become shrink. We call it as atrophy or dystrophy. Yes or no? Atrophy or dystrophy, and that is what is called shosham. So the point is the combined effect of Rucha plus Ushna Guna in a cell, the cell will become dehydrated, degenerated, demyelinated, and finally it will become shosha. Now I am telling you there is a yoga called Vidaryadi Ganam. There is a yoga called Vidaryadi Ganam, and you know what is the indication? What is the indication? I am telling for you. Vidaryadi ayakrityo brahmano vada pittaha shosha gulma anga mardorda shosha kasa karo ganaha. What is the meaning? Actually, listen carefully. For the mild student with alpa buddhi, minimum buddhi, Acharya told it is good for shosha. Wherever you are getting a degeneration, prescribe Vidaryadi. Like in motor neuron disease, prescribe Vidaryadi Durdam. For Madhya Buddhi, little bit brain, he told that it can be given for Vada Pitta Haram. Because Vada, Rucha, Pitta, Sushna will cause Shosha only. For the Maha Buddhi, he told only one word, Brahmana. So Brahmana is equal to Vada Pitta Hara is equal to Shosha Hara. This is the way how Acharya told about a drug. He was so student loving. He was quite sure that NCSM syllabus इतना बड़ा है. बोबो कुमार जैसा मंदबुद्धि लोग आता है, क्लास में काम करता है. Students will not be understanding whose seat. He told three things in a single slogan. Brahmana, Vadavittagara, Shosha, all the three conveys the same message. Are you getting me? Yes or no? So my dear friends, analyze the classical concept of Ayurveda with the incorporation of modern medical input. Definitely you will feel that this science is not to be discussed, this science is to be practiced. Yes or no? This science is not to be discussed in a hall, this science is to be practiced in a outpatient or inpatient. That is my humble request to you. So this is a cell. What happens by Rucha Guna to this cell? What happens by Snigdha Guna to the cell? What happens by Guru Guna to the cell? What happens by Lidu Guna to the cell? That authentic knowledge is called Vikalpa Samprapti. Clear? So next time onwards my aim, if you accept what I told, my visit to this place is fulfilled. You know, I am traveling from Kerala, Costa to Shaka here. So if you are identifying this is the need of the hour, it is clear that, so visualize a cell. What happened by the ahara, vihara, which guna, which dosha, then what is the rogastu dosha vaishya. I think it is clear. Okay, now one more thing. These are the modern nidanas for external cell injury. Very important. You take any modern basic pathology, these are the factors which will disturb the cell. I am telling you, according to Ayurveda, rogastu dosha vaishya. According to modern medicine, disease is due to cell injury. Disease is due to cell injury. Cell injury kaise hoga? That is a naked question. Then Davison's answer, Harrison's answer. Davison, Harrison, what they told is simply told by our acharyas. What did they told? Hypoxia and ischemia. What is hypoxia? Less oxygen. What is ischemia? Less blood. Less oxygen, prana, less blood supply, rectal. Yes or no?
Yes, sir.
So what they told, we also told. So Devi Putra Samhita, Davison. Hari Putra Samhita, Harrison. Our acharyas also told the same, that is the pranavarodham, hypoxia, rectavarodham, ischemia, and physical agents, all the trauma, physical trauma, all the sunrise, all the temperature, anything physical trauma, abhigada, marma. Then chemical agents, all dushi visha, all the chemicals in Ayurveda, and microbial agents, all the bhuda, krimi, visha, everything, and the immunological agents, all the vyadi shamata, immunity, ojo dushti, everything, and nutrition derivatives, all the post-ragatic yoga, staurya, kasya, everything, and psychological factors mentioned in Ayurveda, kama, krodha, lobha, moha. So everything told by the modern medicine as the pathological compartments of external pathology, simply told by Ayurveda by two lines sloga, ye bhuda, visha, vaiva, kinchada, bhangadi, sambhavaha, kama, krodha, bhayadyasta, tesu, jagandavo, gata. Are you getting me? So cell injury by the above factors is as similar as the agandubhavas mentioned in Ayurveda. That is why you should read the text with a practical orientation. So reaching the Ayurvedic diagnosis, follow the clinical features thoroughly, fix the dosha level, then go to the doshyas and site of the disease. Listen carefully, I am going to the next case. Vata with Luksha Guna, Kopa, Intok leads to Parishya, Karasparsana, Spudana, depending upon its Velasamrati, think about the Kushtapeda. You imagine a paddy field. If there is normal water, the paddy field is filled with mud. That is normal. If there is over dehydration, the water will be lost and then cracks will develop. This is Vata. If there is more flood, continuous rain for 5 days, the entire paddy field will be getting water, kapha filled with the swelling. Are you getting me? Over water, flood, kapha, swelling, shobha. Underwater, dehydrated, duksha vada, crack. So this is the way we have to take. When you are getting a case with vipadika, what is vipadika? Cracks in the field. Vipadika, padagari, cracks in the skin. It is Rusha triple plus. Rusha plus dehydration. Rusha plus K. Rusha plus cracks. Then you need this Nigda plus. That is why Jivanyadi, Yamadam, Trivarta, Mahan, etc. apply. And when there is more Kapha plus mild swelling, Kapha plus moderate swelling, Kapha triple plus important swelling, you need all the pathological treatments against the Shobha like Levana, Ubana, Nasreda, everything. So what I am telling, Guna as it increases in the order, you should take the opposite Guna in the same order. The thing is, Vritti Samani Sarvesha. Very easy. Now you find that every sloga is having an application. First time you are feeling that the slogas are not for shoga. Actually, teachers and students agree that sloga karana naam shreshta. हमारे मन में दुख उत्पन्न होने वाले कारणों में सबसे आगे क्या है सर? श्लोगा. एंड श्लोगा को किधर हो क्या होता है कंठावरोध होता है. श्लोक बाहर नहीं आता, इसका मीनिंग है कंठा अवरोधम. आपको श्लोक बाहर जरूर आना है, पेशेंट्स को देना है. reduce the gap between principle and the practice. I always tell word. What is word? Word is a document told in the text. Aptavachya, Pramanam, Siddhantam, Shastram. Word is the Pramanam in the science. Ward is the place where we apply the treatment. That is hospital ward. What is the spelling of word? W-O-R-D. So are you asking such a silly question? W-O-R-D, everybody know. What is the spelling of ward? W-A-R-D. Which letter changes? O changed into A. O for opportunity, A for action. Every word in the textbook is to be applied in the practice. That is action. Never keep a word as a word with the shoga and rodha. Take the word out and apply it as an action. Then word will be converted into action. Action by the physician, action by the system, action by the science of Ayurveda. And that is what I am telling. When you apply the principle into the practice, the principles will be getting naturally justified. That is why I am telling all the cases only. Okay, leave it. This we already discussed. Now another case, Vamana in psoriasis. So this is, psoriasis is a notorious autoimmune inflammatory condition where you are getting auspicious sign, candle sign. You can see the patient up. You can see the patient upper arm. See the patient's upper arm. You can see plague-like appearance. Plague-like appearance. And I had done Snehapana with the Tiktagagradam. Tiktagagradam was given for Snehapana because this patient was a chronic alcoholic patient. And then I have done Vamana Karma. You know how I did Vamana Karma? I collected 4 drugs, 2.5 grams of Madana Pippali, that is the seed of Madana, Randia dematorum, 5 grams of the powder of Vaja, Equus calamus, Vaja, 7.5 grams of the Yeshti Madhu, Glycyrrhiza glabra, and 10 grams of the Saitava mixed with the honey, and Vamana was given. Very good Pitta Darshana was there, and patient got the symptomatic improvement. Again, repeated treatment was needed. Only by Vamana Karma, nobody's psoriasis will be cured. You need a continuous Shodhana followed by Shamana. My Shamana medicines were the very simple Nili Tulasiyadi Kashaya and the Mahamani Bhadra Gulam and externally Vajraka Tailam and Ayyapala Tailam combination. So what I am telling, wherever you are getting a recurrent chronic pathology, you need systemic Shodhana. Dosha Kadadi Kupirti Jida Lenkana Padanehi, Edu Samshodhane Shuddha, Natesha Punaruddhava. What is the meaning? The diseases which are treated by Samyak Shodhana, the chances of recurrence will be comparatively minimum. That is why if the patient is otherwise eligible, never hesitate to do Shodhana. In generally, as per my belief, there will be certain Kaphanubandham in such a chronic disease. I am telling a point, wherever there is Kapha, the disease will be Chidakaya. It will be very slow in the patient. Whenever there is Pittam, the disease will be Ashukaya. And whenever Vada, it will be Upaya. Sometimes increasing, sometimes decreasing. Okay. Now the next case, bronchial asthma. Again, I regularly practice Vamana Karma because Kaphavarutta, Kapovarutta, Gamanaka, Pavadu, Shekvastida, Prana, Budaka, Annavahi, Nigusta Sodansi, Dushayat, Udastaka, Kurude. So we can see the middle picture. See the dilated normal bronchiole. And you can see the upper picture, the congested. The congested upper picture is telling that there is Sama Kapha. What do you mean by Sama Kapha? Sama Kapha will always create Vibantha. Samo Valasa Duganda, Sudugara Vibantha Krit. And we have done again Vamana Karma. See the second patient, Induganda Gada was given for Snehapana. Then in same Vamana drug, patient got very good relief. Again followed by Shamanagilisa. Now please go to the that folder and you go to the Vamana. You just open the folder, you reduce the PowerPoint first. This is the Vamana Karma for that, see, that first patient, psoriasis. Nirnibandham, just like a Gana Pravaham only from his mouth. The total, the area you can see the plaques and next Vamana Karma, okay. Let the video complete. This is the Vamana Karma done in psoriasis. Now close this video. And go to the folder. This is Vamana Karma in Shosa. See, 6 are done. Boundary. Basin के बाहर गए. Basin के अंदर आता है 4. Basin के बाहर जाता है 6. My dear, you play the video once again. Once again, go back. See how I am keeping my hand, Ube Parsha Leladasta Vamadascha Dharaye. You have to keep it. Now I will tell you, if you are a very good experienced man in Panchakarma like Vamana, you will feel the moment when he is going to vomit. How I am testing, I will tell my students to take the photo. I will entrust 2 students. Listen carefully. I will entrust 2 students to take the photo, and the target given is to click the photo before the vomitus lands in the basin. Air may रहना चाहिए vomiters. So they should be keen to click that. They don't know how when the patient is going to vomit, and I can feel. You can see I was keeping my hand in the lelada. What is the science? Ubhe parshe leladascha vamadascha dhare. And I can see how the udana veda is coming and he is vomiting. I will just blink my eyes. They will click it. Are you getting it? The timing. The task to the photographer was to take the photo of the vomiters before touching the basin. How they know? I know. He is going to vomit because I am keeping my hand. This is the hand of sparshana, the hand of empathy, the hand of patient care, the patient love. Remember, Ayurveda is a science of love. I am telling from my left ventricle. So when I feel that he is going to vomit, I will blink my eyes, and then they will click it, and photo will be there. So that is why you can feel Ubhaya Parshadasya. This is simple Vamana Karma in bronchial asthma. You close it. I think there is one more Vamana Karma. You close and go to the folder again, please. I am telling because no, this I think we have already. Okay, it will be there. Same case only, but another video. See, all are going backwards. Students are going backwards. They don't want it to be contaminated by Vamana. Once what happened, I am telling a real story. In the early morning only Vamana should be done. Normally nobody is interested to go early, means Sabere Kumbu Anahana. So nobody is interested to do Vamana Karma. But I will come and my students will also be there. And some after Vamana Karma, one patient is not vomiting properly, and there is no Pitta Darshanam in the vomiters. So I was observing whether there is any Pitta Darshanam in the vomiters, and he vomited on my head, Zero Abhishek. Patient students were very happy. You know what is the reason? Boboma sir will not come to the class. He has to go to the home and take the bath. A good teacher always read the heart of the student. Okay, I am telling it locally. So that is there. You have to see what is happening. That is why when that video was playing, all are going back. Okay. Next. My dear, is there any other video? Vamana PS, same folder. One more video is there in another psoriasis patient. I should make it clear that you people should see all these things. You go to the folder, reduce this folder. See, a fisherman again developed psoriasis. You can see beautiful Ganga Pravaha. One of my favorite Vamana Karma with beautiful vomiters. You can see. Nobody is there. Early morning, 6 o'clock, 6:30. Everything should be finished before 7:30, 7:45. It is done in Trivandrum Government College. Psoriasis, you can see the psoriasis plaques on the hand, chest, a fisherman. Again it will come. See how I am keeping the head, Lelade. It is the picture after giving the Vamana Aushadhi. Now you can see. See, Nirvagandam Pravartande, the Vamana Aushadhi is having that much of action. I think one more is there. So I am telling and showing all these things, practice everything. That is my humble request to all of you. This seminar should alert your clinical consciousness. Because the Glocal University is giving such a wonderful knowledge platform for you. See, continuously getting the patient is not in an uncomfortable posture. We have to give always good support. Okay, close the video and come back to the PowerPoint. I will show other videos later. Okay. Make it active so that I can go to the next slide. Okay, now another case, please. Now from the pulmonology, from the diabetic or ulcer, we are going to a case of neurology. I got a patient with definite involvement of the frontal lobe with lacunar infarct. Lacunar infarct are the small bleeding spots seen in hypertensive patient. Weakness on the right side, difficulty in walking, aphasia. What is aphasia? Difficulty to speak. Aphasia and emotional disturbance. There are three speech disorders: dysphagia, dysarthria, dysphonia. Dysphagia means a difficulty in speech due to a central problem, brain problem. Dysarthria means it's a problem due to articulation. They cannot combine the different muscle, and dysphonia is difficulty in the speech production, larynx. Okay. So this was the case with the lacunar infarct. You can see in the MRI CT scan it is there, bleeding spots are there. And the treatment what we have given to this patient was the treatment exactly mentioned for Artida. Artide, Naganam, Srotre, Mutadinam, Tarpanam. Then the Nayanadi Kashayam was given, Chida Duma was administered, Nasya with the Chida Duma was done, and after that the Rasna Prishakola Pradam was given immediately, and patient got significant improvement, not total improvement. She was able to make some words. Please go to the video, aphasia video. After the treatment, the patient got a little bit of speech and Kalyana. She can identify the question. She is trying to, because the audio output is not there. Close the video. See, in Latina, in fact, emotional incontinence will be there. Since it is affecting the frontal lobe, the patients will be having all emotional. First of all, she was not able to even understand the question. She was able to tell some words. Again, Kalyana Krida was given after the Shodhana Chikitsa Shamana medicine. Kalyana Krida is very excellent drug in such aphasia condition. Pandu Kandu, Vishe, Soshe, Mohe, Mehe, Dere, Jore. I always tell Gori Shankar sir, Vakpada is very student loving. So he was very confident that students should learn the sloka. Now he very well know that learning sloka is difficult. So he wrote the sloka in such a way that they can remember well. I will tell the last line of Kalyana Krudam. Pandu Kandu, Vishe Soshe, Mohe, Mehe, Gere, Jore. See the poetic beauty. Pandu Kandu, Undu, Undu. Mohe, Mehe, Ha, Ha. Vishe Soshe, Sha, Sha. Gere, Jore, Rada. Are you getting me? So if you closely see the sloka, there are so many things by which you can use the sloka for better bypassing. That is Kalyana Krudam. Okay, this is what we told. This is, please pay attention. I am coming to the end of my presentation. Guru Guna in a cell, hypertrophy, hyperplasia, intracellular accumulation. I am connecting the gunas with the modern pathology. Legu Guna in a cell, malnutrition, atrophy. Ushna Guna, inflammation. Shida Guna, stagnation. Snigdha Guna, coating, atharoma, obstruction. Ruksha Guna, dehydration, degeneration. The opposite will be Chikitsa. That is why Chikitsa, friends, there are 6 Guna Avshadas. You know, Shadubakrama, Guru Guna, Brahmana, Legu Guna, Lengana, Ushna Guna, Swevana, Shita Guna, Stambhana, Ruksha Guna, Rukshana, Uddardana, and Snigdha Guna, Snekhamana. 6 gunas in pathology, the opposite 6 gunas in Chikitsa. That is why Shadubakramas are there. Okay. Snehana, Rukshana, Sedana, everybody know. Fatty liver already we discussed. Another a patient with the pain in the calf muscles. I will finish within 5 minutes. You can see this case, please read the case. It's a typical case of peripheral vascular disease. It's a case of peripheral vascular disease. We call it as PVD. What is PVD? What is PVD? PVD means the peripheral blood vessels are not having the very good blood supply, so there will be pain in the calf muscles. They cannot walk. We call it as intermittent claudication, and this is a case of Rektavada Vadam as per Ayurveda. According to Ayurveda, there is a beautiful reference in Vada Rektam. Rektamargam Nihatyashu Shaka Santishu Mayudaha Nivishya Anyonya Mavaya Vedana Purtharatyasun. Anyonya Mavaya means Pranavarana and Rektavarana. Pranavarana hypoxia, Rektavarana ischemia, both will definitely lead to pain. That is what is happening here. And you can see the peripheral arterial disease generally diagnosed by the Doppler scanning, and it is considered as the Rektavada Vada, and the treatments were removal of the Avarana, Rekta Shuddhi and Vata Nilomana. Dear friends, please see the last word, the key word. What is that? Tell louder, what is that? See, treatment is nothing other than bringing Vata Nilomana in the patient at the earliest. Then you may ask me, what is Anilomana? Anilomana is the programmed movement of Vata in any anatomical location. Are you getting me? Programmed movement of Vata in any anatomical location to execute a specific function is called Vata Anilomana. Prana Vata Anilomana, higher mental function. Udana Vata Anilomana, speech, deglutition, and praveshana. Dhyana Vata Anilomana means cardiac cycle, systemic ejection, and Samana Vata Anilomana means gastric secretion, peristalsis, Annam Padati, Kripanadi, Vivejayati, Munjadi, and Apana Vatanilokana means mixturation, defecation, menstruation, ejaculation, parturition, Sukla, Artava, Sagar Mudra, Garbhavishramana Kriya. Are you getting me? You know why I started from there to here? When I was telling this Anilomana, my Anilomana will only make you alert. Yes or no? If I am standing there and sleeping there, he will be having a Samuha Vidya. So Anilomata or the Vata will keep the entire biological activities in the most defined way. So I will tell a definition to Arogya, my own definition, don't write it in examination. Arogyo Anilomana Meva. Are you getting me? See, if you are getting Anilomata or Vata in any cell, then only that cell can survive. A cell-to-cell communication. One cell will communicate with another cell. One cell will communicate within the cell. Intracellular communication, intercellular communication is nothing other than that is Anilomata. The hypothalamus is sending a signal. Hypothalamus is sending a signal. Then pituitary will secrete TSH. Then thyroid will produce T3, T4. So hypothalamus to pituitary to thyroid, pranavada, vyavaram, prana, anilomana. Are you getting me? So my humble point is identify what is anilomana. Anilomana is nothing other than the systemic programmed movement of vada in any place. If vada is in anilomana stage, that gland will secrete. If vada is in anilomana, the blood will flow. If vada is in anilomana, the nerve will be carrying the impulses. If the anilomana is normal, the mudra will be traveling through the ureter. If the anilomana is normal, progesterone, estrogen will be produced in the normal way. So ultimately, the entire biological activities of the body are controlled by vada. Anilomana, that is why with the Vaina Yatra Niyandi, Tatra Gachanti Megavat, one more sloga, Viditwa, Rashtrayatwa, Viditwa, Nanya Sodandriya, Dudulogata, Doshana, Prabhayo, Anila, Vais, Tandra, Yandra, Daraha. See, that is why he dedicated on chapter. There is no Pittaragalium, no Kabagalium, only Vada Galium. That is the Vada. So this is the treatment we are doing. Rekta Moshana by Galukamacharana we are doing. Uddardana, Ganyamana we are giving on all the medicines which were indicated for Rekta is given, including Madhyashthyadi Tailam. A beautiful yoga is called Madhyashthyadi Tailam that can be given internally as Panam, that can be given internally as Vasti, and that can be given externally as Apinga. So Madhyashthyadi Tailam and Madhukailika Vasti, all these treatments are time-tested protocols against peripheral vascular disease. So Rekta Mosha, you can see actually Rekta Mosha, very important treatment. Very important treatment. You know, धन्वंतरि के हाथ में क्या है? जड़ूका. भगवान शिव के गले में क्या है? Snake है, king cobra है. And Lord Shiva is carrying the big snake, and Vishnu can also hold a minimum anaconda. But he opted a simple creature called Jaluga because according to the modern clinical analytical study, more than 25 chemicals have been identified in the Jaluga saliva, like dextrose, bedyl, interleukin, hyaluronic acid, and all these chemicals are having three properties. They are vasodilator, thrombolytic, analgesic. See, 1, 2, 3. Vasodilator, you know, dilation of the blood vessels, and thrombolytic, removing the block, and then analgesic. So when you keep a Jaluga to a wound, it will liberate saliva which will work in the peripheral system by which the local blood vessel will dilate and blood flow will come to there and healing will naturally happen. That is why Gravida Hekte is Jaluga. Gravida means clotted. Clotted blood you have to do Jaluga. That is why modern medicine told Jaluga saliva contains thrombolytic agents. Ayurveda beautifully told only one word, Gravida to Jaluga. Gravida means clotted. That is very much applicable with the modern concept of thrombolytic activity by Jaluga. Are you getting me? So everywhere when you are getting a problem with the disturbed or defective circulation, think about Jaluga. In my hospital, in my OPD, daily I do this Jaluga. Okay. And last case, a case of acute skin inflammation. I got this patient who is going to write the examination, a girl patient. she's having allergy to the modern medicine, so she should get relief by Ayurvedic medicine only. And you can see the picture. Tell me the first picture, what is the dosha domination? If you listen to my class, you will tell the answer. What is the dosha domination by the first picture? Please. Kapha, Pitta, right? Because red color is there, no doubt. Daka, Ragam, Pagam, Pitta, and Bullas are there. Certain things are dilated with the water, so it is a condition of Kapha, Pitta. No doubt, it is a condition of Kapha, Pitta. Second picture is there is no Bulla, but only cellulitis, typical Pitta. My dear friends, Daka, Raga, Paga, Shoka, Shula, Ushma, Pitta. Daka, Raga, Shula, Shoka, Paga, Ushma, Pitta. I didn't tell, it is told by Vagbada. And what is inflammatory features by Celsius? Rubor, pallor, dolor. The same thing is told in Ayurveda by Daka, Raga, Paga, Shoka, and that is by Pitta, Kapha. And they had given the medicines, and you see the changes. Without any antibiotic, without any modern medicine, 3 days. Virendra by Adipati Churnam, Nimbadi Kashaya. Wherever there is Kapha, Pitta, Kapha means Niddam, Pitta means Niddam, opposite is Pitta Rasa Yuncham, so Nimbadi Kashaya. This is the logic. You never copy from Gopakumar, copy from the logic of Ayurveda. I told you, Ayurveda is not a magical science, Ayurveda is a logical science. So I told you, Kapha, Pitta, both are very evenly identified. Kapha means Niddam, Pitta means Niddam, opposite is Yuncham. Yuncha can be done by only Pitta Rasa. Pitta Rasa is blood purifier and Varnium. So I opted Nimbadi Kashaya. And Nimba is very proven anti-infective drug. Gukulu Panchavala Churnam, Tripala Churnam with the water decoction, washing, and Sharivadhyasam of an internal Arishtakalpana, Vyavaya Guna, better action, Pitta Shaman. This is the logic. And now you see what happened to the patient in the picture. See the first picture, second picture, third picture, last picture. Only ordinary by mobile camera only. And see the last one, and finally you can see from Kapha Pitta to less Pitta to less Pitta to less Kapha, and finally the normalcy has been attained by pure Ayurvedic treatment. And you know that patient's father is a man who is having fish business. So the only merit I got is now I am daily getting fish. Then I told her, don't take fish daily, that may be a case for the rectal dystrophy. So patient didn't get the fish after that, they used to give me fish day by day. So this is Vaidya's gunas, okay. So this is what I am telling, you can see. And last, another case, a patient with anorexia. I am telling only the cases. I want to reduce the gap between the theory and practice. Anorexia, epigastric pain, retrosternal pain, regurgitation of the gastroesophageal conduct. What is the diagnosis modern? Read once again and tell the modern diagnosis. It is nothing other than GERD, gastroesophageal reflux disease. We popularly call it as Amblapittam. Urdhaga Amblapittam. Avivaga Klamol Klesha Pitta Amblogara Gauravaihi. Kirkanda Daha Rigidista Amblapittam. Kirkanda Daha means retrosternal pain. Pitta Amblogara Gaurav means acid regurgitation. And then what were the medicines given? The medicines given are here. This is the typical picture of the gastroesophageal reflux disease, the Ambla Pitta. Pitta's Ambla Guna is increasing. Normally, Pitta is Kadurasa. When Kadurasa Pitta is converted into Ambla Rasa Pitta, which is called Ambla Pitta. Without Ambla Gunodriktam Pitta, Ambla Pitta. And you can see the digestive fire, burning sensation, inflammation of the esophageal mucosa. Everything is there. 3 components. Pachaka Pittam, Kledaga Kapha, Samana Vayu. My dear, when you get any gastric issue, it is not only with the Pitta, you have to think about the Samana Vayu plus Kledaga Kapha plus Pachaka Pitta. These 3 together constitute the biological functioning of Agni. Agni is not a mere Pitta Bhava. Agni means all the 3, Samana Vayu plus Kledaga Kapha plus excellent. So Agni-Rivana, Pitta-Hara, Vata-Nilavana. Here listen one point. You have to bring down the Pitta because Ambla Pitta. Bring down Pitta, but you have to empower Agni. Not that an easy task. In the same thing, you have to bring down the Pitta. Ambla Pitta is increased. Pitta should come down. But same way you have to empower Agni because patient is having Avibhagam. How it is possible? Pitta Rasa. The one and only Rasa among the 6 Shadrasa is Pitta, which can have action on Pitta and good action on Agni. You take a kashaya, pitta, maduraha, pitta, mani, only 3 or 4 pitta. Kashaya will never empower agni. Madura will kill the agni. So among the pitta samana 3 rasa, kashaya, pitta, madura, only pitta is good against pitta samana and agni vaivanam. That is, my dear friends, all the Ayurvedic kashayas are pitta rasa. People tell that, sir, you are giving all mother rasa, honey, ghee, etc. and mix as masti and giving through the gudam, and all the pitta rasa drugs are giving orally. This is the common complaint the patients are telling. When I am writing the medicine for masti, they will tell, you are telling me to buy this much kg of gurda, honey, jaggery, and it is just in the going in the toilet only. And you are giving me guduchali, impadi, pittagam, haditagam, getting orally. But the problem is you are protecting the agni. Yoga, sarvevi, mande, agni. So every science there is a logic, my dear. My ultimate, the only one reason by which I came to here is you should change your way of thinking. The modern practical condition, modern knowledge, modern diagnosis, Ayurvedic classical clinical concepts, go to the practice. You should become the next Charaga. You should become the next Vakpada. You should become the next Susura. That is a simple responsibility. Otherwise, who will be following the science? Are you ready? Yes. Is it very Mandaguna? Yes. Are you ready? Yes. Now it is Tishnaguna only. Very good, very good. Okay, last 2 slides. So the Guduchani, Pittaka, Maharittaka, Chinnodhavadi, my favorite yoga. Chinnodhavadi is a very good yoga mentioned in Chakradatta. It is indicated for Amrita only. I will tell the yoga for you. Chinnodhava, Nimba, Patavala Patram, Palatrigam, Kududam, Sushidam, Shaudranidam, Pidam, Anega Rupam, Sudarinam, Sandihi, Chamravitam. Chinnodhava means Guduji. Tynospora caudifolia, Nimbam, Padavalabatra, Tripana. These are the 6 medicines we can give internally for Amravita. So much clinical studies are there. Padavaladi, everybody know. This again psoriasis already we have seen. Candle grease test, aspergillus. So this is psoriasis, Sigma, and we have treated. I think this is the video you have seen, the fisherman video. See how, when we see such a good Vamana Karma, we will feel happy. Just like a Ganga Pravaham is vomiting, that day will be my happiest day. I will see the Vamana Karma. If I am getting such a beautiful Vamana, that day is divine. And the people will tell that after having a Vamana Karma, how you will take a food. I will take a double quantity of food because my Agni will be empowered after having. See, this is the normal Vamana Karma. See, we will surprise that whether this much gastric irritation was there to make a Vamana Karma. Okay. So last one patient with mental, I told all systemic cases, last only 2-3 minutes. A patient with less interest of food intake, less talking, prefer to be alone, not interested in personal hygiene, that is depression, typical depression, Kapajo Madam. To me, a depressive case can be considered as Vishada with Kapajo Madam. Why Kapajo Madam? Kapan, Aloja Kastaki, Alpe, Hahara, Vakita, Srikamada, Yakapriti, Lala, Sikhana, Suri. Vibration, Shaujanikesham, Nidra, Shuvidarani, Udmado, Belaman Ratu, Bhukta Matre, Vijayani. Somebody who wants to be alone, somebody who is not coming to the social frame, they are withdrawn from the society, no hygiene, no food, Alpahara, Alpavakita, no talking, no Facebook, no chat GPT, isolated. Then definitely it will be a case of Kapajo Mada. And the treatment was given by the Kapaja Unmada, Tamogunam and Kapadosham. Unmadam, Punaga, Mano, Gutti, Sapnana, Smriti, Bhakti, Sita, Cheta, Ajara, Vipramam, Vidya, salutation to Charana. And remove the Avarana, Tamu Avarana by Medya drugs, Nasya Karma, Takradara, and the Shankapushti, Kalyana Kuda, Brahmi Kuda, with the typical drugs we are administered, and he got a very good release. My dear, last video, go to the Vamana Karma, Manasika. Last video, I had done Vamana Karma. This Vamana Karma will show you how difficult it is to do Vamana Karma in a mental patient. Very difficult to do Vamana Karma. This patient doesn't know what is the impact. See, not at all ready to drink the milk. He is there. His brother offered him one mobile phone for getting ready for Vamana Karma. So, mobile dana cha Vamana Karma sasyade. That was my character slogan. Only by getting an offer of mobile, he was ready to undergo Vamana Karma. See, I am telling all the Gita to him. Arjuna Vishana, Gopagoma, Gita. Nobody is there. Area is kept back in early morning. He is looking. No, Ma Vishana, I don't want further milk. See, not spitting, not Vamana, Yoga. This is the case how a Vamana should not be. I told you so many yoga where how a Vamana should be. This is a yoga video how Vamana should not be. Little forward curve, little, I don't know, in between Vamana will come. He is getting Pasega. Little slowly. See, now he is ready. Behind the scene, everything is prepared for this one thing. So, now look his eyes, he is not interested to drink milk. I am the only person who is very close to him. I know anything can happen. No, I will. Nothing is coming, no. Then I told you drink again, my dear. I never loved any patient this much. Even I never loved my wife this much. And you. वो बोलती है मुझे भी इतना दूर नहीं दिया जिंदगी में because the vaidya should be affectionate. Dashna sthirta sastrala dashna karma sudhir abhintere sijistam. He is telling. Then I was telling, if you don't vomit, I will give you again milk. So Dugdha Bhishanad, he was ready. Now it will come. Mali, okay. See. Like that, I told you. Now he got milk. I told, make a sixer, it should go out. You know what happened? Later he became the winner of a reality show. That is what I am telling. He's a big fan of Ayurveda now. Because you know, Sholana Karma will lead to Buddhi Prasadam, Paramindriyanam, Dhatu Sthiratvam, Julagasya Niti, Chijacha Bhagam, Vaisakarodi, Samsodhanam, Samvik Upasyaman. A good Sholana will empower the brain only first. All the neurotransmitters will be empowered. Okay, close the video, will go like that only. And here, I close the video only 1 minute. I considered this case as a Dushi Vishadetma Udmara because he was a drug addict. So the drug addiction was considered as Dushi Visha. And Visha will be leading to Udmara. That was my concept. Visha is Tamoguna and Vishadam is Tamoguna. Visha to Vishadam. Connections are there. Tamoguna, Mano Avaya. So Vamana Karma was done to convert the Vikrita Kapha to the normal Kapha. Vikrita Kapha, depression, normal Kapha, stimulation. That is my concept. That was the reason for doing Vamana Karma. Kalyana Krita was given. And the line of management I told you, Vamana Karma was done, Takradara was given, Vedha Rasayanas were given, Virejana Nasya was administered. So he was happy. You can see Vamana in drug addiction, Dushi Visham. So my humble Ayurveda in mind and soul. That TAMS I got from the university and I am now giving the certificate being the registrar. But in my inner conscious, I do have another TAMS, that is B. Let us tell together B. Ayurveda in mind and soul. In your thought, my inner conscious was telling you study Ayurveda because in 92, because in 2025 November 14 आपको इधर आना है, Glocal में आना है. I am not talking. So I thought that so many people are studying modern medicine, then somebody should study Ayurveda. I was not knowing what is Ayurveda, Sanskrit, very difficult. But after some days I identified that I can study Ayurveda. I remember a day in the evening, very good answer for sir. In the evening when I was studying my first TAMS, there was no electricity in my village. I am from a village. And I used to study in a ordinary land. Then there was no light. You can imagine, there is no electricity, the lamp was not there. And that time I was reading the Doshadadu Aladi Vinyanian chapter. Then I got some idea, so I thought that every word I learn in Ayurveda is having a meaning of interpreting me. I don't know, my dear, I am telling from my heart. All of a sudden I felt that every sloga is having an application level. Then I started working. Then day by day that doors became open. So if you also do the same naturally in the door, I will tell you, my dear, it is not the merit of a teacher like me to talk like this. It is the merit of the science of Ayurveda. Only one sentence I will clear. If you reach that particular level of Ayurvedic consciousness, then Ayurveda will give you the hand and he will take my dear. See, now I am the student. Okay, I am the student. I am somewhere here. He is the Dhanantari. Ayurveda. He is the Dhanantari. Somehow I was able to touch him. Somehow. Only touch it. You catch me. Go first. And then he will take me. I will follow. You will think that the Bhagavan is going. Science is leading. Are you getting me? This is what happened to me. I am telling from a level. Okay. Once you touch the level of Ayurvedic consciousness, that consciousness will be naturally carrying you. Then people will think that the Bhagavan is coming. No. I was starting by standing on that particular platform of Amravita, which was told by the science. I could luckily touch it. Are you getting me? Once you switch on the switch, definitely the light will be there. Who is responsible for the light? Is it switch? The electricity is the internal dynamic energy that is called Ayurvedic wisdom. So try to touch it. Don't go for shocking. Don't touch it if it is going away. And then you will be getting shocking. So gradually empower. So thank you so much for your wonderful patience and listening. I am sure that you will become very good. Thanks for the clapping. Thanks for the clapping. But always I used to tell, hasta samyogam, no use. What you need is hasta pustaka samyogam. You know, there is a pustaka in your home. So instead of hasta samyogam, hasta pustaka samyogam, take charana bhagavata susuta in your hand. Hasta pustaka samyogam, pustaka mastaka samyogam. Pustaka mastaka samyogam, mastaka Manava Samyoga. That is what I expect from you. Now you can come. Okay, thank you so much.
Thank you so much, sir, for that enlightening and deeply inspiring session. Your talk has beautifully reflected how the timeless principles of classical Ayurveda continue to guide modern clinical practice with such clarity, compassion, and scientific precision.
Indeed, sir, listening to your clinical experience was like witnessing the living Ayurveda in action